Medicare and Medicaid fraud, waste, and abuse prevention. This module explains Medicare and Medicaid fraud, waste, and abuse prevention. This training module was developed and approved by the Centers for Medicare and Medicaid Services, the federal agency that administers Medicare, Medicaid, the Children's Health Insurance Program, and the Health Insurance Marketplace. The information in this module was correct as of April 2020. To check for an updated version, visit cmsnationaltrainingprogram.cms.gov. The CMS National Training Program provides this as an informational resource for our partners. It's not a legal document or intended for press purposes. The press can contact the CMS press office at press@cms.hhs.gov. Official Medicare program legal guidance is contained in the relevant statutes, regulations, and rulings. This communication was printed, published, or produced and disseminated at U.S. taxpayer expense. The lessons in this training module explain Medicare and Medicaid fraud, waste, and abuse prevention, detection, recovery, and reporting. These materials are for information givers, trainers who are familiar with the Medicare and Medicaid programs and who use the information for their presentations. The module consists of 54 slides and speakers' notes and includes check your knowledge questions. It can be presented in about 45 minutes. Allow approximately 15 more minutes for discussion, questions, and answers. You should consider adding more time for additional activities you want to include. This session should help you define fraud, waste, and abuse, identify causes of improper payments, discuss how CMS fights fraud and abuse, explain how you can fight fraud and abuse, find resources of additional information. Lesson 1 offers an overview of fraud, waste, and abuse, defining healthcare fraud, waste, and abuse, protecting the Medicare trust funds and other public resources, examples of Medicare and Medicaid fraud, who commits fraud, causes of improper payments, quality of care concerns. Medicare and Medicaid fraud, waste, and abuse affects every American by draining critical resources up from our healthcare system and contributing to the rising cost of healthcare. Taxpayer dollars lost to fraud, waste, and abuse harm some of our most vulnerable citizens. Fraud occurs when someone intentionally deceives or misrepresents to get money or property from a healthcare benefit program. Medicare fraud assumes criminal intent. CMS works to prevent and identify possible fraud. Ultimately, our judicial system determines if someone committed an act of fraud. An example would be a provider that repeatedly and intentionally is billing Medicare for services or supplies not provided. In contrast, waste is overusing services or other practices that directly or indirectly result in unnecessary costs to any healthcare benefit program. Using medically unnecessary services or durable medical equipment, DME, or prescription drugs, or using more disposable DME or drugs like syringes, diabetic test strips, disposable diapers, or underpads than needed over a period of time are examples of waste. Generally, waste isn't considered to be a criminal act, but rather the misuse of resources. Abuse happens when healthcare providers or suppliers perform actions that directly or indirectly result in unnecessary costs to any healthcare benefit program, like billing Medicare for services that aren't covered or aren't properly coded. In the case of abuse, the provider hasn't knowingly and intentionally misrepresented the facts to obtain payment. The primary difference between fraud, waste, and abuse is intention. Note, since fraud is ultimately determined by our judicial system, typically we note potential fraud until those concerns have been adjudicated. Protecting taxpayer dollars. The Center for Medicare and Medicaid Services, CMS's mission is to put patients first in all of our programs. This includes supporting innovative approaches to improve quality, accessibility, and affordability while finding the best ways to use innovative technology to support patient-centered care. To improve affordability, CMS must protect the Medicare Hospital Insurance Part A Trust Fund and the Supplementary Medical Insurance Part B Trust Fund. The Medicare Hospital Insurance Trust Fund pays for Part A benefits like inpatient hospital care, skilled nursing facility care, home health care, and hospice care. It's funded by payroll taxes, income taxes paid on Social Security benefits, interest earned on trust fund investments, and Part A premiums from people who aren't eligible for premium-free Part A. The Supplementary Medical Insurance Trust Fund pays for Part B benefits, including doctor services, outpatient hospital care, home health care not covered under Part A, DME, certain preventative services, lab tests, Medicare prescription drug Part D benefits, and Medicare program administrative costs. Its funding is authorized by Congress from Part B premiums. Medicare premiums, Medicare prescription drug plan Part D premiums, and interest earned on trust fund investments. The federal government contributes to annual Medicaid expenditures, and CMS must protect the public resources that fund the Medicaid programs operated by the states, the District of Columbia, and U.S. territories. CMS continues to explore opportunities to improve program integrity and oversight by conducting comprehensive audits of exchange processes to verify their integrity. CMS released the 2019 Health and Human Services Exchange Program Integrity Final Rule on December 20th, 2019. For more information, visit the cms.gov website. CMS has to manage the careful balance between paying claims quickly and limiting provider burden in conducting reviews that prevent and detect fraud. Examples of possible fraud. Some examples of possible fraud include Medicare or Medicaid is billed for services you never got, or for equipment you never got, or that was returned. A provider bills Medicare or Medicaid for services that would be considered impossible. For example, a provider billing for therapy that totals more than 24 hours within a given day. Someone alters documents to get a higher payment. Dates, description of furnished services, or your identity are misrepresented. Someone else uses your Medicare or Medicaid card with or without your knowledge. A company uses false information to mislead you into joining a Medicare plan. So who commits fraud? Most individuals and organizations that work with Medicare and Medicaid are honest, but some aren't. A small minority of doctors or employees of healthcare providers may commit fraud or intentionally use abuse program rules. We call these individuals and organizations problematic providers. Sometimes organized crime is at the root of the problem, resulting in financial losses that easily climb into the millions of dollars. In less common instances, people who have Medicare or individuals who have stolen their identities may be instigators. CMS is continually taking steps necessary to identify and prosecute these offenders. Any of the following are capable of being involved in Medicare and Medicaid fraud: waste and abuse, doctors, pharmacists, and other healthcare providers and their staff, DME suppliers, hospitals, pharmacies, ambulance services, and home health organizations, people with Medicare, Medicaid, or individuals who have stolen their identities, telemarketing companies. It's important to be aware of the various entities that have been caught up in fraud schemes. Those who commit fraud could be individuals who are in or pretend to be in any of the above mentioned groups. Improper payments. An improper payment, according to the Government Accountability Office, is any payment that shouldn't have been made or that was made in an incorrect amount, including overpayments and underpayments. Under statutory, contractual, administrative, or other legally applicable requirements, causes of improper payments include errors, waste, abuse, and fraud, also known as mistakes, inefficiencies, bending the rules, and intentional deception. CMS's program integrity activities target all causes of improper payments, from honest mistakes to intentional deception. Contrary to common perception, not all improper payments are fraud, that is, an intentional misuse of funds. In fact, most improper payments are due to unintentional errors. For example, an error may occur because a program doesn't have documentation to support someone's eligibility for a benefit, or an eligible person gets a payment that's too high or too low due to a data entry mistake or inefficiencies. Also, many of the overpayments are payments that may have been proper, but were labeled improper due to lack of proper documentation. CMS believes that having proper documentation would show that many of these overpayments were actually proper, and the amount of improper payments actually lost by the government would be even lower than the estimated net loss. CMS uses provider education and outreach to help avoid billing errors and uses its payment suspension authorities in case of suspended fraudulent conduct. These activities are designed to make sure legitimate providers and suppliers get paid correctly for the appropriate and reasonable services and supplies they give to people with Medicare and Medicaid. Visit the CMS.gov website to review the Medicare Learning Network's educational products on fraud, waste, and abuse. Common causes of improper payments. CMS must report improper payment information each year in the annual Department of Health and Human Services Agency Financial Report. You may access this report by visiting the Health and Human Services website. The supplemental data for this report is available at cms.gov and can give more details about improper payments. This chart from the supplemental data shows that the common causes of improper payment by percentage of 2019 national improper payments. Past reports are at the Health and Human Services.gov website. Improper payment transparency, Medicare. This graph shows the rate reduction goal for each fiscal year, FY. Under the Accountable Government Initiative, Medicare and Medicaid are considered high error programs. Medicare processes more than 1 billion fee for service, FFS, claims per year. The FY 2019 improper payment rate was 7.25%. The Medicare FFS improper payment rate decreased from 8.1% in FY 2018 to 7.25% in FY 2019, which is below the statutory threshold of 10%. Since FY 2017, these decreases have saved nearly $7 billion in estimated improper payments. Home health and skilled nursing facility corrective actions resulted in a combined significant $5.32 billion decrease in estimated improper payments from FY 2016 to FY 2019. Visit the CMS.gov website for more information. The factors contributing to improper payments are complex and vary from year to year, but the primary causes of improper payments continue to be insufficient documentation and medical necessity errors. For rate information, visit cms.gov. Also calculates and keeps scorecards for improper payments processed throughout the federal government. Improper payment transparency, Medicaid. Medicaid is the primary health coverage for more than 75 million Americans, and in FY 2018 paid more than $402.9 billion in benefit claims. The FY 2019 improper payment rate was 14.9% with $57.36 billion in improper payments. While the Medicaid improper payment rate increased between FYs 2018 and 2019, we can't compare these rates because we significantly changed how we measure them. Specifically, we calculate Medicaid's national improper payment rate differently than Medicare's. Medicaid's is a rolling improper rate that includes findings from the 3 most recent measurements. Each time we measure a group of 17 states under the payment error rate measurement, PERM, the previous measurements for that group of states are dropped from the calculation and the newest measurements are added. In general, the national rate is calculated by multiplying each state's most recently observed error rate by the state's expenditures and dividing by total expenditures. For more information about how we calculate the rate, visit the cms.gov website. Some reasons the improper payment rate increased are that we started using the PERM, P-E-R-M, eligibility component for the first cycle of 17 states. We'll finish reviewing the rest of the 33 states and the District of Columbia under the new eligibility requirements over the next 2 years. In FY 2021, once all the states are measured under the new requirements, we'll also establish a baseline. Improper eligibility payments for Medicaid and CHIP are made mostly because there's not enough documentation to verify eligibility, related mainly to no verification of income or resource. Verification was started, but there wasn't documentation to show it, and non-compliance with eligibility redetermination requirements. The CHIP improper payment rate also went up because of claims for beneficiaries who were incorrectly found to be eligible for CHIP. but later found eligible for Medicaid mostly because of how their incomes are calculated. Newer requirements to revalidate and rescreen providers aren't being met. Existing provider enrollment screening and national provider identifier requirements still aren't being met. Consequences of sharing your healthcare information or number. There are consequences if you share your healthcare card or number with anyone other than your healthcare providers. Your medical records could be wrong. The next time you go to your doctor, you'll have to explain what happened so you don't get the wrong kind of care. You could be charged with healthcare fraud and spend time in jail if found guilty. You might lose your benefits. If you have Medicaid, you can be limited to certain doctors, drugstores, or hospitals. Note: CMS is reviewing monetary fines for people with Medicaid who have participated in fraud. You could be placed into the Medicaid lock-in program, which limits you to certain doctors, pharmacies, and hospitals. Lock-in may be used for people with Medicaid in these circumstances. You could be placed into the Medicaid lock-in program, which limits you to certain doctors, pharmacies, and hospitals. These circumstances are visiting hospital emergency department for non-emergency health concerns, using 2 or more hospitals for emergency department services, using 2 or more doctors resulting in duplicated medications and/or treatments, exhibiting possible drug-seeking behavior, requesting a specific scheduled medication, narcotics, requesting early refills of scheduled medications, or reporting frequent losses of scheduled medications. Also, using multiple pharmacies to fill prescriptions. Preventing fraud in Medicare Advantage, MA, and Medicare prescription drug plans. Providers aren't the only focus in preventing Medicare fraud. Medicare health plans and Medicare drug plans that contract with Medicare have responsibilities beyond billing. Plans are responsible for ensuring that they market to people with Medicare in responsible ways that protect them and the Medicare program from marketing practices that could result in fraud. This includes the plan's agents or brokers who represent them. Here are some examples of activities that Medicare plans and people who represent them aren't allowed to do. Send unwanted emails without an opt-out function, visit homes uninvited to encourage enrollment in their plan, call or text non-members unless given permission, offer cash to join their plan, nominal, non-cash gifts under $15 are allowed, give free meals at sales or marketing events, talk about their planned and restricted areas like exam rooms, hospital patient rooms, treatment areas, and pharmacy counters, areas where people get health care. For more information, view the Medicare Communications and Marketing Guidelines at the CMS.gov website. Note: although the Medicare Drug Integrity Contractor fights fraud, waste, and abuse in Medicare Advantage, MA plans, and Medicare prescription drug coverage, Part D, they don't handle MA and Part D marketing fraud. To report plans that ask for your personal information over the telephone or that call unsolicited to enroll you in a plan, call 1-800-MEDICARE or 1-800-633-4227. TTY 1-877-486-2048. Telemarketing and fraud, durable medical equipment, DME. There are telemarketing rules for DME. DME suppliers, people who sell equipment such as diabetic supplies and power wheelchairs, and any entity on behalf of the supplier are prohibited by law from direct solicitation to people with Medicare unless given prior consent to sell their products. Direct solicitation means direct contact and includes telephone, computer, email, instant messaging, and in-person contact. DME suppliers must be in compliance with the supplier standards of 42 CFR 42.57. See the CMS.gov website for complete details. Potential DME scams include calls or visits from people saying they represent Medicare, phone or door-to-door selling techniques, equipment or service like genetic testing is offered for free and then you're asked for your Medicare number for record-keeping purposes. Being told that Medicare will pay for the item or service if you provide your Medicare number. Note: to report suspected DME scams, call 1-800-MEDICARE or 1-800-633-4227, TTY 1-877-486-2048. Here are common examples of fraud. Genetic testing and braces. The U.S. Department of Health and Human Services Office of Inspector General, the HHS OIG, is alerting the public about fraud schemes involving genetic testing and orthotic braces. Genetic testing fraud occurs when Medicare is billed for a test or screening that wasn't medically necessary and/or wasn't ordered by the treating physician. Similarly, durable medical equipment fraud happens when Medicare is billed for an orthotic brace that you didn't need and/or wasn't ordered by your treating physician. Medicare only covers these items when they're medically necessary and ordered by your doctor. Scammers may try to offer you free screenings for genetic testing and/or medical equipment, like back or knee braces, in exchange for your Medicare information. The free screenings may come in the form of an in-person screening, a cheek swab, or a testing kit in the mail. Braces may arrive in the mail or be advertised on TV, radio, or by a direct phone call. If you agree to this testing or equipment and Medicare denies the claim, you would have to pay for the entire cost of the item, which could be thousands of dollars. Genetic test names can vary and include cancer screening/test, DNA screening or test, hereditary cancer screening or test, dementia screening or test, Parkinson's screening or test. Pharmacogenomics, medication metabolization. Here are the quality of care concerns. There's a specific quality improvement organization, QIO, dedicated to addressing the concerns of people with Medicare and their families called the Beneficiary and Family-Centered Care, BFCC QIO. Patient quality of care concerns aren't necessarily fraud. Examples of quality concerns that your BFCC QIO can address include medication errors, like being given the wrong medication, being given medication at the wrong time, being given a medication to which you're allergic, or being given medications that interact in a negative way. The BFCC QIU can evaluate if the situation merits Medicare drug integrity contractor intervention. Change in condition not treated, like not getting treatment after abnormal test results or when you developed a complication, being discharged from the hospital too soon, incomplete discharge instructions and/or arrangements. To get the address and phone number of the BFCC QIO for your state or territory, visit medicare.gov/contacts and search for information on the topic of complaints about my care services, or call 1-800-MEDICARE, 1-800-633-4227. Check your knowledge. Question 1. Blank occurs when someone intentionally deceives or makes misrepresentations to get money or property from any healthcare benefit program. A, abuse. B, improper payment. C, fraud. Or D, none of the above. The answer is C, fraud. Fraud occurs when someone intentionally deceives or makes misrepresentations to get money or property of any healthcare benefit program. Check your knowledge. Question 2. Billing errors always show a healthcare provider's or supplier's intent to commit fraud. A, true, or B, false? The answer is B, false. Contrary to common perception, not all improper payments are fraud, that is, an intentional misuse of funds. In fact, most improper payments are due to unintentional errors. For example, an error may occur because a program doesn't have documentation to support someone's eligibility for a benefit, or an eligible person gets a payment that's too high or too low due to a data entry mistake or inefficiencies. Lesson 2 discusses the following organizations and strategies to detect and prevent fraud and abuse: the Centers for Medicare and Medicaid Services, CMS, the Center for Program Integrity, CPI, CMS Program Integrity Contractors, CMS Administrative Actions, Law Enforcement Actions, the Healthcare Fraud Prevention Partnership, HFPP, Healthcare Fraud Prevention and Enforcement Action Team, HEAT. Education efforts. The Centers for Medicare and Medicaid Services, CMS. CMS moved beyond the pay and chase approach to healthcare fraud to a more proactive and transparent approach by creating a rigorous screening process for providers and suppliers enrolling in Medicare, Medicaid, and Children's Health Insurance Program, requiring cross-termination among federal and state health programs, so providers and suppliers whose participation has been terminated by a Medicaid program or a CHIP may have its Medicare billing privileges revoked. Providers and suppliers who have their Medicare billing privileges revoked are barred or terminated from all other Medicaid and CHIP programs. Temporarily stopping enrollment of new providers and suppliers in high-risk areas. Medicare and state agencies watch for trends that may indicate a significant potential for healthcare fraud and can carry stop enrollment of a category of providers or suppliers, or enrollment of new providers or suppliers in a geographic area that has been identified as high risk. The market saturation and utilization data tools includes an interactive map and a data set that show national, state, and county level provider services and utilization data for selected health service areas. The interactive trend graph shows the nation and state level trends for the user selected geographies over time for the available metrics and health service areas. CMS can use the data to monitor market saturation as a means to help prevent potential fraud, waste, and abuse. The data can also be used to reveal the degree to which use of a service is related to the number of providers servicing a geographic region. Coordinating with the private and public health payers and other stakeholders to detect and deter fraudulent behaviors within the healthcare system. Providing outreach and education to key stakeholders to reach the program objectives. CMS's Center for Program Integrity, CPI. Within CMS, Center for Program Integrity, CPI, coordinates the Medicare and Medicaid program integrity activities focused on detecting and preventing fraud, waste, and abuse. CPI coordinates the work of anti-fraud contractors to investigate Medicare providers and conducts audits of Medicaid providers to identify potential overpayments. Program integrity contractors are nationally coordinated Medicare, Medicaid program integrity team contractors to cut across regions. They include Unified Program Integrity Contractors, UPIC, Recovery Audit Program, National Benefit Integrity Medicare Drug Integrity Contractor, NBI, MEDIC, Investigative Medicare Drug Integrity Contractor, IMEDIC. The UPIC operates in a geographical area or jurisdiction defined by individual task orders to maintain Medicare and Medicaid program integrity by detecting, preventing, and proactively discouraging healthcare fraud, waste, and abuse. UPIC brings together the former functions of GPICs, Medicare, Medicaid, data match contractors, and the Medicaid integrity contractors into a single contractor to perform Medicare and Medicaid program integrity work on behalf of CMS. Such activities include coordinating audits, conducting investigations with federal and state law enforcement, performing Medicare, Medicaid claims data analysis, and recommending administrative actions. The UPIC contracts operate in 5 separate geographical jurisdictions in the U.S. The map shows the current UPIC contractors for the 5 geographical jurisdictions. Other territories in the Western jurisdiction include American Samoa, Northern Marianas Islands, and Guam. Medicare, Medicaid, Medi funding allows for CMS to match Medicaid and Medicare claims and other data to identify proper billing and utilization patterns. This data matching can show trends that aren't obvious from each program's claims data alone. Medi is a funding stream which has been incorporated into the regular activities of the UPICs as they collaborate with states on potential investigations and audits. States voluntarily choose to participate in Medi, and Medi activities are carried out as separate tasks under the CMS program integrity contracts. The Recovery Audit Program's mission is to reduce improper payments by efficiently detecting and collecting overpayments, identifying underpayments, and putting into place actions that will prevent future improper payments. States must establish Medicaid Recovery Audit Contractor, RAC programs, and the programs must identify and recover overpayments and identify underpayments, coordinate their efforts with their auditing entities, including state and federal law enforcement agencies. CMS and states work to minimize the likelihood of overlapping audits. States are required to report all overpayments and underpayments to CMS. For more information, visit Medicaid.gov. CMS has two Medicare Drug Integrity Contractors, or MEDICs, the National Benefit Integrity, NBI, MEDIC, and the Investigations, MEDIC, iMEDIC, monitor and investigate fraud, waste, and abuse in Medicare Advantage and Medicare prescription drug coverage. MEDICs have investigators throughout the country who work with federal, state, and local law enforcement authorities and other stakeholders. Clarence is the program integrity contractor for CMS under the NBI MEDIC contract, as well as the iMEDIC contract. Clarence's key responsibilities include investigating potential fraud, waste, and abuse, investigating complaints alleging Medicare fraud, performing proactive data analyses, identifying program vulnerabilities, and referring potential fraud cases to law enforcement agencies. Clarence's website at QLARANT.com/contracts has all forms under iMEDIC section. Referrals should be submitted to the new iMEDIC complaints email address at imediccomplaints@QLARANT.com. Items forwarded from the Office of Inspector General, OIG, hotline should be submitted to the new iMEDIC OIG hotline email address at i-medic, MEDIC, underscore, OIG underscore, hotline at QLARANT.com. To view an interactive U.S. map representing the various contractors that work with CMS, including UPICs, NBI MEDICs, ONE MEDICs, visit the CMS.gov website. When CMS suspects fraud, administrative actions include automatic denials, a don't pay claim status for items or services ordered or prescribed by an excluded provider, payment suspensions, a hold on paying claims status until investigation or request for information is completed, prepayment edits, coded system logic that either automatically pays all or part of a claim, automatically denies all or part of a claim, or suspends all or part of a claim, so a trained analyst can review the claim and associated documentation to make determinations about coverage and payment. Revocation of billing privileges, which occurs for noncompliance, misconduct, felonies, falsifying information, and other such reasons set forth in 42 CFR 424.535. Revoked providers are barred from participating in the Medicare program for a minimum of 1 year, but no greater than 10 years, depending on the severity of the basis for revocation. If providers are revoked from Medicare a second time, the bar can last up to 20 years. Providers may repeal a revocation determination by submitting a corrective action plan only in cases of noncompliance, or by submitting a request for reconsideration. Post-payment reviews to see if there were overpayments, and referrals to law enforcement. When law enforcement and the judicial system determine fraudulent activities, the following enforcement actions may occur. Providers or companies are barred from the programs. The U.S. Department of Health and Human Services, the HHS, OIG, has the authority to exclude individuals and entities from participating in federally funded healthcare programs. Providers and companies can't bill Medicare, Medicaid, or CHIP. Providers or companies are fined. Arrests and convictions. Corporate integrity agreements may be negotiated between OIG and healthcare providers and other entities as part of the settlement of federal healthcare program investigations arising under a variety of civil false claims statutes. Providers or entities agree to the obligations. In exchange, OIG agrees not to seek their exclusion for participation in Medicare, Medicaid, or other federal healthcare programs. The Healthcare Fraud Prevention Partnership, HFPP, is a voluntary public-private partnership between the federal government, state and local agencies, law enforcement, private health insurance plans, employer organizations, and healthcare anti-fraud associations. The HFPP aims to foster a proactive approach to detect and prevent healthcare fraud through data and information sharing. The HFPP's purpose is to improve the detection and prevention of healthcare fraud by exchanging data and information between the public and private sectors, leveraging various analytic tools against datasets provided by HFPP partners, providing a forum for public and private leaders and subject matter experts to share successful anti-fraud practices and effective methodologies for detecting and preventing healthcare fraud. For more HFPP information, visit hfpp.cms.gov/about/index.html. The Healthcare Fraud Prevention and Enforcement Action Team, or HEAT, is a joint anti-fraud initiative between Health and Human Services and the U.S. Department of Justice, the DOJ. HEAT task forces are interagency teams comprised of top-level law enforcement and professional staff members. The team builds on existing partnerships, including those with state and local enforcement organizations, to prevent fraud and enforce anti-fraud laws. HEAT uses interagency collaboration to reduce and prevent fraud in federal health care programs. By deploying law enforcement and trained agency personnel, HHS and DOJ increases coordination, data sharing, and training among investigators, agents, prosecutors, analysts, and policymakers. Project HEAT has been highly successful in bringing forth healthcare fraud cases and prosecuting them quickly and effectively. The mission of HEAT is to gather resources across the government to help fraud, waste, and abuse in the Medicare and Medicaid programs, and crack down on fraud perpetrators who abuse and cost the system billions of dollars. Reduce healthcare costs and improve the quality of care by ridding the system of perpetrators who prey on people with Medicare and Medicaid, highlight best practices of providers and public sector employees dedicated to ending fraud, waste, and abuse in Medicare, and build upon existing partnerships between HHS and DOJ to reduce fraud and recover taxpayer dollars. The joint HHS/DOJ Medicare Fraud Strike Force is a multi-agency team of federal, state, and local investigators designed to fight Medicare fraud. The wide geographic spread of Medicare Fraud Strike Force team locations shows that Medicare fraud is a nationwide problem. Current operations are running in identified fraud hotspots, including Baton Rouge, Brooklyn, Chicago, Dallas, Detroit, Houston, Los Angeles, Miami-Dade, and Tampa Bay. Strike Force teams are advanced data analysis techniques to identify high billing levels in healthcare fraud hotspots. Interagency teams can target emerging or wandering schemes along with chronic fraud by criminals masquerading as healthcare providers or suppliers. CMS is working collaboratively with federal and state law enforcement partners to increase the recovery of improper payments and fraud by giving data and other support during healthcare fraud prevention and enforcement action investigations and prosecutions, and by suspending payments to providers subject to credible allegations of fraud. For Strike Force news and activities, visit oig.hhs.gov/fraud/strike-force. CMS is using education efforts to shift focus onto the prevention of improper payments of fraud while continuing to be vigilant in detecting and pursuing problems when they occur. For provider resources, visit cms.gov. Provider education helps correct vulnerabilities so that providers maintain proper documentation, reduce inappropriate claims submissions by educating providers on common billing mistakes, protect patient and provider identity information, establish a broader culture of compliance. Educating people with Medicare helps strengthen the fight against fraud by teaching them to identify and report suspected fraud. For a copy of the Program Integrity Beneficiary Card Toolkit, visit the cms.gov website. Protecting Yourself and Medicare from Fraud is a free publication to help people with Medicare get information on how to detect and protect against fraud and identity theft. To read or download this publication, visit Medicare.gov. Check your knowledge. Question 3. The Healthcare Fraud Prevention and Enforcement Action Team, or HEAT, is a joint anti-fraud initiative between the U.S. Department of Health and Human Services, or the HHS, and the U.S. Department of Justice, the DOJ. A, true, or B, false? The answer is A, true. HEAT is a joint anti-fraud initiative between HHS and DOJ. HEAT task force are interagency teams comprised of top-level enforcement and professional staff members. The team builds on existing partnerships, including those with state and local law enforcement organizations, to prevent fraud and enforce anti-fraud laws. HEAT uses interagency collaboration to reduce and prevent fraud in federal healthcare programs. By deploying law enforcement and trained agency personnel, HHS and DOJ increase coordination, data sharing, and training among investigators, agents, prosecutors, analysts, and policymakers. Lesson 3. Lesson 3 discusses how people with Medicare and Medicaid can fight fraud. Senior Medicare Patrol, SMP. 4 R's for fighting Medicare fraud. Medicare.gov/fraud. Medicare Summary Notices, or MSNs. MyMedicare.gov. 1-800-Medicare. Protecting personal information and ID theft. Reporting Medicaid fraud, and helpful resources. Through outreach, counseling, and education, the Senior Medicare Patrols, or the SMPs, empower and assist people with Medicare, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. SMPs are grant-funded projects of the U.S. Department of Health and Human Services, HHS, Administrative for Community Living, the ACL. Their work covers 3 main areas. 1. Conduct outreach and education. SMPs give presentations to groups, exhibit at events, and work one-on-one with people with Medicare. Since 1997, more than 30 million people have been reached during community education events. More than 6.5 million people with Medicare have been educated and served by more than 46,000 volunteers. 2. Engage volunteers. Protecting older persons' health, finances, and medical identity while saving precious Medicare dollars is a cause that attracts civic-minded Americans. The SMP program engages over 5,200 volunteers nationally who collectively contribute more than 155,000 hours each year. 3. Get complaints from people with Medicare. When people with Medicare, caregivers, and family members bring their complaints to the SMP makes a determination about whether or not fraud, error, or abuse is suspected. When fraud or abuse is suspected, they make referrals to the appropriate state and federal agencies for further investigation. There are SMP programs in each state: the District of Columbia, Puerto Rico, Guam, and the Virgin Islands. Each CMS regional office has an SMP liaison. SMP seeks volunteers to represent the program in their communities. For an in-depth overview of the SMP program and for information for your local area, visit smpresource.org or call the nationwide toll-free number at 1-877-808-2468. Callers get information about the SMP program and are connected to the SMP in their state for individualized assistance. You can also email them at info@smpresource.org. You're the first line of defense against Medicare fraud, and Medicare.gov/fraud is a good place to learn about resources available to protect yourself, your loved ones, and Medicare, like tips to prevent fraud, how to spot fraud, how to report fraud, rules for people selling Medicare plans. You can also learn the marketing rules for Medicare health plans and what people selling these plans are and aren't allowed to do. There are Medicare summary notices, MSNs, for Part A and Part B, and for durable medical equipment, DME. The MSN shows all services and supplies that were billed to Medicare, what Medicare paid, and what you owe each provider. Review your MSNs carefully to make sure you got the services and supplies for which Medicare was billed. If you have other insurance, check to see if it covers anything Medicare didn't. Keep your receipts and bills and compare them to your MSN to be sure you got all the services, supplies, or equipment listed. If you paid a bill before you got your notice, compare your MSN with the bill to make sure you paid the right amount for your services. If an item or service is denied, call your doctor's or healthcare provider's office to make sure they submitted the correct information. If not, the office may resubmit. If you disagree with any decision made, you can file an appeal. If you find items listed in your claims that you don't have a record of, it's possible that you or Medicare may have been billed for services or items you didn't get. If you think a charge is incorrect and you know the provider, you may want to call the office to ask about it. The person you speak to may help you better understand the services or supplier you got, or your provider may realize a billing error was made. If you've contacted the provider and you suspect that Medicare is being charged for healthcare you didn't get, or you don't know the provider or the claim, report the suspected fraud to 1-800-MEDICARE or 1-800-633-4227, toll free at 1-877-486-2048. For more information or to view samples of the Part A, Part B, and/or DME MSNs, visit Medicare.gov. You can also access MSNs electronically, e-MSNs, through mymedicare.gov. You can also see the next slide. Note, MA plans and prescription drug plans provide an explanation of benefits, or EOB, that offers similar information. The EOB is an enrollee communication that gives enrollees clear and timely information about their medical and/or drug claims. To support informed decisions about their healthcare options, plans are required to issue EOBs that include the information reflected in the CMS-developed templates. To see the templates and instructions, visit the cms.gov website. Medicare Part D sponsors must make sure that enrollees who use their prescription drug benefits get their EOBs by the end of the month following the month in which they used their prescription drug benefits. The 4 R's for, pardon me, I'm just going to go back here, skip a slide. MyMedicare.gov is Medicare's free, secure online website for accessing personalized information regarding Medicare benefits and services. Creating a Medicare account gives you access to your personalized information at any time. Review eligibility, entitlement, and preventative service information. Access and, if needed, print a copy of your Medicare card. Check personal Medicare information, including Medicare claims, as soon as they're processed. Check your health and prescription drug enrollment information, as well as any applicable Part B deductible information. Get help through live chat. Review claims for Medicare Part A and Part B and identify fraudulent claims. You don't have to wait to get your MSN in the mail to view your Medicare claims. Use your Medicare account to track your Medicare claims to view electronic MSNs or EMSNs. Your claim will generally be available within 24 hours after processing. If there's a discrepancy, you should call your doctor or supplier. Call 1-800-MEDICARE or 1-800-633-4227, TTY 1-877-486-2048 if you suspect fraud. The 4 R's for fighting Medicare fraud are: record the dates of doctor's appointments on a calendar. Note the tests and services you get and save the receipts and statements from your providers. If you need help, ask a friend or family member. Contact your local Senior Medicare Patrol SMP program to get a free personal healthcare journal. To locate the SMP program in your area, use the SMP locator at smpresource.org or call 1-877-808-2468. The second R is review Medicare Advantage plan or prescription drug plan explanation of benefits and Medicare summary notices. For signs of fraud, including claims you don't recognize and advertisements or phone calls from companies offering free items or services to people with Medicare. Compare the dates and services on your calendar with your MSNs and/or EOBs to make sure you got each service listed and that all the details are correct. If you find items listed in your claims that you don't have a record of, it's possible you, Medicare, or your Medicare plan may have been billed for services or items you didn't get. To review your Medicare Part A and Part B claims, create or log in to your account on Medicare.gov or call 1-800-MEDICARE, 1-800-633-4227. You can get help from your local SMP program with checking your MSNs for errors or suspected fraud. If you're a Medicare Advantage, MA plan, or Medicare Prescription Drug Plan, PDP, call your plan for more information about a claim. The third R is report suspected Medicare fraud by calling 1-800-MEDICARE, 1-800-633-4227, or TTY 1-877-486-2048. When using the automated phone system, have your Medicare card with you and clearly speak or enter your Medicare number in letters. If you identify errors or suspect fraud, the SMP can also help you make a report to Medicare. The fourth R is remember to protect your Medicare number. Don't give it out, except to your doctor or other healthcare provider. Never give your Medicare number in exchange for a special offer or to a telemarketer. If you need medical services, start with your own doctor. Medicare will never contact you and ask for personal information, like your Medicare or bank account numbers. Never let someone use your Medicare card and never use another person's card. The 4 R's for fighting fraud you can find at the medicare.gov/pubs/pdf/11610-4R-4-fighting-fraud.pdf. People with Medicare can call 1-800-MEDICARE, 1-800-633-4227, or TTY 1-877-486-2048 to make a complaint and report fraud. 1-800-MEDICARE has an interactive voice response, an IVR system, available for people who haven't registered or don't use a Medicare account. The IVR can access 15 months of original Medicare claims processed on their behalf if they're available. The data gathered helps the Centers for Medicare and Medicaid Services, the CMS, to target providers and suppliers with multiple consumer complaints for further review, track fraud complaints to show when fraud scams are heating up in new areas. Using existing data in this innovative way lets CMS target providers and suppliers with multiple consumer complaints for further investigation. Carefully review the facts before you report errors, fraud, or abuse, and have the following information ready when you call 1-800-MEDICARE. Provider's name and any identifying number you may have, information on the service or item you're questioning, the date the service or item was supposedly given or delivered, payment amount approved and paid by Medicare, the date on your MSN, and your name and Medicare number as listed on your Medicare card. People with Medicare can call 1-800-MEDICARE, 1-800-633-4227 to make a complaint and report fraud. The data gathered helps the Centers for Medicare and Medicaid Services to fighting fraud can pay. You may get a reward if you meet all of these conditions. The suspected Medicare fraud you report must be investigated and validated by Medicare contractors. The reported fraud must be formally referred to the Office of Inspector General, OIG, for further investigation. You aren't an excluded individual. The person or organization you're reporting isn't already under investigation by law enforcement. Your report leads directly to the recovery of at least $100 of Medicare money. Learning activity. Jennifer has concerns and wants to discuss her MSN with you. What parts of the MSN should she look at to be sure there were no mistakes or fraud? Discussion is on. Next slide. MSN activity. What questions should you ask? Was Jennifer charged for any medical services she didn't get? Are the dates of services correct? Was she billed for the same thing twice? Does her credit report show any unpaid bills for medical services or equipment she didn't get? Has she gotten any collection notices for medical services or equipment she didn't get? To help protect against identity theft, Medicare has mailed new cards to people with Medicare. Your Medicare card has a Medicare number that's unique to you instead of your Social Security number. Keep your personal information like your Medicare number, Social Security number, credit card, and bank account numbers safe. Only share this information with people you trust, such as your doctors, other healthcare providers, and plans approved by Medicare, insurers who pay benefits on your behalf, trusted people in the community who work with Medicare, like your state health insurance assistance program, or SHIP, or Social Security office. If you aren't sure if a provider is approved by Medicare, someone calls you and asks for your Medicare number or other personal information, call 1-800-MEDICARE, 1-800-633-4227. Identity theft occurs when someone else uses your personal information, like your Social Security number. If they're using your Medicare or Medicaid numbers, it's considered medical identity theft. It's a serious crime. If you suspect identity theft or feel like you gave your personal information to someone you shouldn't have, you can call your local police department, visit identitytheft.gov, call the Federal Trade Commission's ID theft hotline at 1-877-438-4338. You can also visit ftc.gov/ID theft for more information about identity theft or to file a complaint online. Medical identity theft is a special type of identity theft where someone uses your Medicare or Medicaid number to submit fraudulent claims to Medicare, Medicaid, or other insurers without your permission. Medical identity theft can result in false or misdiagnoses, treatment for conditions you don't have, incorrect lab results, bills for services you didn't get, denied services or prescriptions, inaccurate medical history record. If you need to replace your card because you think that someone else is using your Medicare number, report it right away. Call 1-800-MEDICARE at 1-800-633-4227. View a public service announcement about medical identity theft from OIG at their YouTube site. You may report suspected Medicaid errors, fraud, or abuse to these organizations. Medicaid Fraud Control Units, MFCUs, investigate and prosecute Medicaid fraud, as well as patient abuse and neglect in healthcare facilities. You may file complaints or suspected Medicaid fraud directly to an MFCU. Download contacts at the oig.hhs.gov website. The U.S. Department of Health and Human Services Office of Inspector General, OIG, certifies and annually recertifies each MFCU. Report fraud online at oig.hhs.gov/fraud/report-fraud. Report fraud by mail at HHS Tips Hotline, P.O. Box 23489, Washington, D.C. 20026-3489. You can also call 1-800-447-8477 to report fraud. You can also report suspected fraud and abuse to your state medical assistance Medicaid office. You may locate them at cms.gov/apps/contacts. Learn more about Medicaid fraud at medicaid.gov/medicaid/program-integrity/index.html. Here are some key points to remember. The difference between fraud, waste, and abuse is intention. Fraud occurs when someone intentionally deceives or makes misrepresentations to get money or property from a healthcare benefit program. Ultimately, our judicial system determines if someone committed an act of fraud. In contrast, waste is the overuse of services or other practices that directly or indirectly add avoidable costs to the Medicare program. For example, using medically unnecessary services or durable medical equipment, DME, or prescription drugs, or using more disposable DME or drugs like syringes, diabetic test strips, disposable diapers, and underpads than needed over a period of time. Generally, waste isn't considered to be a criminal act, but rather The misuse of resources. Abuse happens when healthcare providers or suppliers perform actions that directly or indirectly result in unnecessary costs to any healthcare benefit program. While there are many causes of improper payments, many are honest mistakes. The most common error is insufficient documentation. CMS fights fraud, waste, and abuse with support from program integrity contractors and through partnerships with organizations like SMPs. Suspected fraud must be forwarded to law enforcement for additional investigation and prosecution. You can help fight fraud, waste, and abuse with the 4 R's: record, review, report, and remember. You are the first line of defense. Education and outreach about fraud helps combat the problem. Medicare and Medicaid Fraud and Abuse Resource Guide. Here are a list of acronyms. Stay connected. Visit cmsnationaltrainingprogram.cms.gov to view NTP training materials and to subscribe to our email list. Contact us at training@cms.hhs.gov.